What's up, Tallahassee? What's up, Leon County? What's up, Florida? And what's up, the United States? What's up to the world? We are back. I am Joseph Ward. I'm here with Mr. Matthias Sweet and Miss Elena Steeple. We're part of the HIV/AIDS Ryan White team here at Neighborhood Medical Center, and we back for another episode of Mind, Your Body, and Soul. We know it's been a little time, a little minute, but hey, life is happening, and us three, we got a lot going on, but we're gonna make sure that we always get back to this podcast. So you're gonna have times we dip off that, do a few things, but we're always gonna come back to this podcast. So with that being said, we want to thank everybody who's been supporting us from the beginning, all of our new supporters, all of our new viewers. Thank y'all, thank y'all, thank y'all. Remember, subscribe to this channel, like this video. The like is one of the most important metrics of this video. YouTube really likes that. They like likes and views. So we need this to be liked and we need it to be watched. And then after that, make sure you comment because that helps the algorithm, and share it as well so as many people as possible can get this information. This is Mind Your Body and Soul, and Mind Your Body and Soul is the healthiest podcast you have ever heard in your entire life. We're also an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. We're available on our website at www.nmcpodcast.com, as well as our parental website at www.neighborhoodmedicalcenter.org. We're available through audio on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. And of course, right here on YouTube. Show us some love. Show us some love. Show us some love. I tell y'all what, if y'all help us get our subscriber count, we trying to get up to about 300 subscribers. Help us get up to about 300 subscribers, and Miss Steeple gonna sing for y'all. She gonna perform for y'all. Yeah. So if you want to see Miss Steeple perform, 300 subscribers.
Mm-hmm.
Ain't
Now
that
she's gonna do that, Joe. She's gonna do that "To Be Real" song.
That
like
To Be
Real.
There
Cheryl Lynn, man. Cheryl Lynn.
you go.
Woo-hoo.
So
Love it.
before we jump into it, because this is National Health Center Week for 2022. We're a little virtual this year. I know in the past years we'll be more face to face, but we're a little more virtual in 2022. But before we get into National Health Center Week, kind of do some catching up. So, how have things been going with you, Miss Steve?
Things been going okay. Not bad this summer. Kind of hot and hot and hot.
Right.
And
Right.
we have I don't think this summer, I don't think I have seen the number of new positives, the amount of new positives, new HIV positives. I don't think I've seen a summer like this where it has been that number of new
Right.
positives. I mean, literally, it's like 2 and 3 a week, and it's been that way.
What day?
Yeah, and so that is what I don't know whether or not it's COVID that has kept people in, or I don't know what it is, but I'm just amazed at the number of new positives per week that neighborhood has been seeing. On the flip side of that, I'm really glad that we're seeing that, because that means that people are coming into care. But on the other side of that, that means I don't want to say that people are a little careless in reference to uh, the intimacy that they have with another person, whether or not they're talking to each other, whether or not they're listening. So that's my biggest take back so far this summer.
Gotcha. What about you, Matthias? What's been going on, and how are things going?
We're working, doing multiple things besides just patient care and doing program director, working in the clinic, doing outreach, doing COVID, now switching to monkeypox to
Mm-hmm.
doing a lot of other things like that as we do as, health centers are on the front line. So we're seeing
Mm-hmm.
things daily that probably other providers aren't really seeing because,
Mm-hmm.
saying people are calling us trying to get vaccines, trying to get different things that they
Mhm.
probably wouldn't do for their normal, saying healthcare provider. So it's just it's a lot. But you know what? We're here, we're in the trenches, and that's what we signed up for. So I
Mhm.
mean, we
That's
ain't got no
right.
choice but to say, hey, we in it.
Well,
We
That's
just
right.
eat.
the people haven't seen either one of you all in a while. So people been like, hey, where Miss Steeple at? Where Matias at? They're like, where the Mexican, Puerto Rican, Dominican man at?
Be gone. I be in the clinic. I want to be on here, but working up patients and
Yeah.
doing
A
the other
lot.
part of the job that's really, the behind the scenes part that nobody really sees is
Mhm.
where I be at most of the time. I be trying to get on the podcast. I be trying. It just
It's
it
all
ain't
good. I'll
never
be letting them know. It's a lot going on. But
Yeah, yeah. And the best part about it is that I understand the patients who would love to see me in person, but there is this huge amount of patients also that are so grateful to the telehealth because they work. Their kids are out of school for the summer and they don't have anybody to sit with their kids. And this allows them to at least allows me to connect with them, to go over their labs, to find out what else is going on. It's just another avenue that that healthcare has put in the mix. So one day we will come back. You will see me in person, but just to let you know that telehealth has been a blessing to many, many, many other people.
yeah.
And like I said, people who work, they could take their 15-minute break, talk to me, and then they're still in care. And that for that I'm grateful for.
See, that leads us into our discussion for today because, like I said earlier, we're celebrating National Health Center Week for 2022, and this National Health Center Week is like no other that we've experienced, especially as a team. Because,
Hmm.
like you say, we're in an environment where the effects of COVID is still out here.
Hmm.
So, with
Hmm.
that being
Hmm.
said, like you just explained, you're using telehealth,
Hmm.
but we
Hmm.
also have the presence of monkeypox.
Hmm.
But for our program,
Hmm.
HIV/AIDS, COVID, monkeypox, and all of the other disparities that already existed.
Hmm.
But these three are existing at one time, and that's a challenge. That's going
Hmm.
to be a
Hmm.
challenge for us moving forward because
Hmm.
we were, and Miss Steeper, you can speak more to this, but we were just kind of wrapping our heads around HIV and COVID coexisting
Hmm.
at the same time,
Hmm. Hmm.
and so um, and then we might have to Google, we might have to do our screen sharing Google, but I do just want to ask,
Hmm.
how do you think the presence of COVID and or monkeypox, well, COVID and monkeypox in the person's body that already
Hmm.
has HIV, how do you think that will affect the body negatively?
Oh my gosh. Another virus to wreak havoc. Another virus to wreak havoc. You're never going to have a bacteria or a virus or a fungus that does not leave its footprint somehow. And the thing is that a lot of people don't know is that monkeypox has been around since the 1970s,
Right,
but
right,
it has been contained,
right.
and now it's like the cat is out of the bag
because the old
because,
monkeypox is the smallpox, correct, Miss Steeple?
well, it's in that family.
Yeah.
Yeah, it's in that family. And I'm old enough to say, oh boy, here we go. I remember getting the smallpox vaccine,
Hmm.
and when I was in elementary school, and here it is, and they would line us up. It was I do, and they would line us up. They would have this like huge steel gun, and they would
Hmm.
just go "Payow," and we'd be like, "What the living?" And we were little kids, not knowing that it was smallpox. But they said that those of us who have been vaccinated against smallpox, we should be good against monkeypox. But you know what? I just I just don't know. I just don't know. Viruses change,
Right.
and once again, it monkeypox was found in the cradle of mankind, Africa. So everyone says, "Oh yeah, but now it's the new HIV." No, no, it's not the new HIV. HIV is still there.
The most
So
HIV.
so it can be transmitted, personal contact, skin to skin, and what a lot of people don't realize is that it also can be transmitted respiratory respiratory droplets. You will have to be in close contact with the person, but it can be transmitted through
Right.
respiratory droplets.
So before we get deep into like the viruses and how they behave and things, Matthias, from a from a programmatic perspective, dealing with monkeypox, COVID, and HIV, programmatically, how has this affected patients? How has that affected how we treat patients?
Well, because a lot of times, like as you know, most STDs and things can take form, like syphilis is known as the great imitator. So a lot of these different things, depending on where the body rash is, because the body rash can go all over the whole entire body. It can go from face to genitals to, saying to the rectum area. So it might be thinking you could have like a regular STD, but it's monkeypox. Or, how most people look at like even with COVID, it's the same symptoms like cold, flu-like symptoms,
Mhm,
headaches,
mhm,
muscle aches, body ache,
mhm,
exhaustion,
mhm,
fever. Those are the like if you're looking at all those. So as a program person who's looking at things on like letting people in the building, seeing what's going on, we have
mhm,
to really be careful and have our patients really be honest with us and tell them what's really going on, because
mhm,
it's not only for their sake but for our sake as well.
mhm,
Because if you can
mhm.
only imagine, if you get a couple of cases of COVID through a clinic or something, you can shut
Oh,
down a whole clinic. Or with monkeypox, because then everybody's exposed and people don't understand the exposure for monkeypox could start like almost takes almost 21 days sometime for
yes,
some people to actually
Yeah.
show signs and
So we
symptoms.
yeah,
yeah.
yeah,
Normal.
yeah.
Then you have to wait till all your scabs and stuff clear up. But it
Mhm,
could be with the simple. A lot of people right now it's allergy season. A lot of people are mistaken. Oh, I got a stuffy nose, runny nose, or something like
mhm,
that, and they say, oh, it's just allergies. But it could be COVID. It could be
mhm,
monkeypox. It could be anything.
mhm,
And not
mhm,
saying to downplay or to make people scared, but you have to look at those things and we have to be extra cautious. So
mhm,
just bear with
mhm,
your healthcare people for when people trying to say, hey, no, you can't come in right now. We'll do a telehealth appointment. You'll still be seen. It's just that we're just trying to make sure that we keep you safe as well as we keep us safe, because we don't, if something else is here and you just have a cold, and already most of our patients who have HIV already have a weakened immune system. So,
mhm.
a common cold could take them out. So
That's
just
right.
imagine what something else could be and do. But if you see signs, start looking at your body. That's what a lot of people don't do. Start looking
Mhm,
at your body, see what's going on, see what your norm is, how you
mhm,
normally feel. Is this something you normally feel like versus
mhm.
just walking in and saying, yeah, I just don't feel well
Yeah,
Right.
and
right.
say nothing. So just saying, be a little vague with us and say, hey, I might got a rash, or hey, I got something else. The primary care providers are going to see you. It's just we might not see you in that building or in a certain
Mhm,
capacity you want to be
mhm.
seen.
Right.
And just to let y'all know that it doesn't have to be quote unquote a rash. It actually can be
Mm-hmm.
one lesion that starts off the whole thing. You
And it
Right.
could
know,
pop up one and then pop up some later, so you
that's
don't know.
right.
And it could look
That's
like
right.
anything. It could be like a pimple, a
I like
raised
a
bump.
pimple. Mm-hmm. Mm-hmm.
We don't know
Yeah.
because what I'm saying, it's new. We still really don't know what it
You
all
still
looks like.
don't
We
really
just go
know.
off of
That's
what
right.
other stuff do. So that's part of the thing too. From a programmatic standpoint, you got to look at now. We got to revamp protocols on how we do things, what
That's right.
questions we ask people. So it's a big thing. So bear with us because we all in this together and we're trying to figure it all out at one time and trying to figure out the best way that we can provide
Mm-hmm.
safe health care to everybody.
So let me read this real quick, and this is from the CDC.
Mm-hmm.
It's about monkeypox, and it says monkeypox is a rare disease caused by infection with the monkeypox virus. Monkeypox virus is part of the same family of viruses as variola virus, the virus that causes smallpox. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox. Monkeypox was discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox, the source of the disease remains unknown. However, African rodents and non-human primates might harbor the virus and infect people. Uh, signs and symptoms. Signs and symptoms. So people with monkeypox get a rash that may be located on or near the genitals, the penis, testicles, labia, and vagina or anus, and could be on other areas like hands, feet, chest, face, and mouth. The rash will go through several stages, including scabs before healing. The rash can initially look like pimples or blisters and may be painful or itchy. And that's supporting what you guys were saying.
Mm-hmm.
Other symptoms of monkeypox can include fever, chills, swollen lymph nodes, exhaustion, muscle aches, backache, headache, and respiratory symptoms. Doesn't that sound like COVID symptoms?
Mm-hmm.
Mm-hmm.
Right.
Mm-hmm.
So you may also experience a few symptoms. So sometimes people have flu-like symptoms before the rash. Some people get a rash first and then the symptoms, and others only experience a rash. And it says monkeypox symptoms usually start within 3 weeks of exposure to the virus. If someone has flu-like symptoms, they will usually develop the rash within 1 to 4 days. Monkeypox can be spread from the time symptoms start until the rash has healed, all scabs have fallen off, and a fresh layer of skin has formed. The illness typically lasts 2 to 4 weeks. And there's something else I was reading here. It says monkeypox is a viral infection transmitted during prolonged face-to-face contact or doing intimate physical contact, such as kissing, cuddling, or sex.
Mm-hmm. Mm-hmm.
So,
That's right.
so
That's
it's
right.
supporting. It basically is supporting what you guys are saying, but it's also opening up our minds to really pay attention to what's going on to our bodies and what's happening. We have a lot of even HIV can cause flu-like symptoms.
Yes. Yes. Yes.
So,
Yes.
so the three things that we're focusing on today: HIV, COVID, and monkeypox all can initially have the same symptoms.
Yes. Yes. And the thing is that because you can put one of those in a bag and you don't know which one is going to jump out first,
Right.
just and this is another thing that I'm really proud about is working for a federally qualified health center, is that we are on the front lines. That's the thing. You know, people shy away. Some people shy away from coming to a federally qualified health center. They'll say, "Oh no, I don't want to go there," so they'll go to their private doc, and their private doc has no clue. He doesn't have the resources. He or she doesn't have the resources. They have they don't know anything. And so if you do come to a federally qualified health center, or what we call a lookalike, or just a national health center, then you have to know that you're going to get information that is passed down to us from the federal government, because we get our information, our sources of of research and just regular data, that comes directly from the federal government. And that is one thing you can be sure of, that we have been handed information that would help what a
Uh-huh.
community, right? The
Right.
state, the
Right.
nation. So I just wanted to say that is to our advantage, you know, and
So,
to anyone who comes to a federally qualified health center, this is to our advantage, or to a person's advantage if they seek help
okay.
through us.
So, okay. So that's monkeypox. So, how is COVID still affecting us now?
Oh, uh, once again, you know, that doggone COVID is like the HIV virus, like any other virus that is out there. It changes, and that's one thing that we have noticed, is that it goes through its different, I guess you could say, appearances, or it's different. The coat, I always say, it's a virus of many colors and coats,
Right.
because it can mutate. It looks one way, it acts one way today, and it can be something tomorrow, something different. However, it still has the same genetic makeup as the original SARS COVID virus. And
Right.
so it is still affecting us. That's why, please, folks, if your provider asks you, would you like a vaccine? Have you been vaccinated? Have you been boosted? And you have not, please do yourself a favor and please get vaccinated. If you have already vaccinated, please get the boosters. This thing is still taking lives. It
Yeah.
is still it is still causing cases of long COVID.
I think people have gotten comfortable because it's not as prominent in the news cycles as it was 2 years ago.
I think you're right,
And
Joe.
and yes, we're not having as many new cases because I just googled it. So according to the New York Times, because they're able to show an update on the new cases. So they're going from June 15th of 2020.
Hmm.
Actually, so they're going from March 15th of 2020
Hmm.
until yesterday, until August 10th of 2022. So according to this New York Times, as of August 10th, 2022, there in the state of Florida, there are 8,477 new cases, and there's a 8,304 7-day average of new cases for the state of Florida.
But did you hear that number, Joe? You didn't say that there are two new cases. You didn't say that there are 10 new cases. Heck, you didn't even say 1,000. You said what?
8,000. 8,000.
8,000. That means 8,000 people moving across the state,
Right. But see, but
possibly
I think that's
infecting others.
qualified though. When you say moving across the state, that's the qualifier. People aren't
Mhm.
people aren't stagnant, and
Mm-mm,
we're
mm-mm.
also in a time where people aren't stagnant, but on the other end, we have less and less people wearing their mask now.
That's
People
right.
have really
That's
gotten comfortable without wearing the mask, and those are in addition to the people who already didn't want to wear masks or wasn't wearing masks.
right.
So, just from a health precaution standpoint, I think we should always be thinking about our health, but we should always be conscious about how what we do does affect other people.
It does.
It
It,
does affect
it
other people.
does. Very good point,
Affect
Joe.
anybody that you come in contact with on a daily basis. Because I use this example. So let's say I'm in my home.
Hmm.
I live in my house by myself, and what I do in my house is my business to a point.
Right.
But
Right.
the
Right.
behavior that I have in my house, when I come out of my house, it negatively affects everybody around me.
That's exactly right.
Now,
That's
so
exactly right.
so at
That's
what point?
exactly right.
At what point do everybody stick with the mindset of I just need to mind my business? Well, it's no longer just it's my business now because it's affecting me. And I
Right.
think this is how we
Right.
need to look at our existence within this time of COVID and monkeypox. The way I exist affects the way you exist.
That's exactly. Well, that's why we have three infectious diseases at the same time that's occurring. That's why. Because when they ask that infamous question, am I my brother's keeper? The answer should be yes, but most people are asking it from years ago with Cain and Abel. Am I my brother's keeper? He
Right.
was basically saying, no, I'm not my brother's keeper.
Right.
But yes, you are, because what you do out in public affects all of us. It does. It affects all of us. And I think, we have all come down to the point where we want people to do right if we're infected. But before we get infected, you're like, really care about that person? I don't really care about that person. But when you become infected, and by the way, monkeypox is a painful, can be a painful.
So go into that, please.
Yes.
Expand on that, please.
Well, we all know that COVID has the muscle aches and has the fatigue, but monkeypox is painful. Those lesions, just like with genital herpes, when the blisters come, that is a very painful disease. And you just don't want to, think about yourself. Think about the little kid that is possibly getting monkeypox. What if they don't have the vocabulary to tell their parents they're in pain? That is, it is a painful. So now we go from HIV to COVID, where we just feel like we have a really bad flu, to now monkeypox can resemble the flu, and it's painful.
Right.
So we really do. I know this day and time, I know we don't want to think about others, but we have to, folks. Let's do the right thing. Let's just do the right thing.
Right. So let me play. I found this video. This is a Good Morning America video, and this
Okay.
the title is "This is what it's like living with monkeypox." I want to play this real quick.
Okay.
So many new things to protect in life. A little care helps to keep things alright. Nationwide is on your side.
And as you can see, my face looks different. That's because I have monkeypox.
I remember seeing like dots on my face, like pimples almost, it looked like.
I started having swollen lymph nodes, I started having a headache, I started having a fever, and I just felt overall just really lethargic and really tired.
This is one of the most painful things that I've ever dealt with in my life.
The spots first appeared on my hands and my arms, and over the course of the day, they actually progressed all over my body.
I started to see spots on me, spots on myself.
So they swabbed one lesion over here, and I believe one lesion on the other side of my face, and I got the results back in 2 days, and it was positive monkeypox.
I had yet to hear my result until today, Tuesday. I have seen my primary care physician, who basically told me that to take Tylenol. And then my symptoms got worse. I went to the ER.
I called 311, I called the Department of Health, I called emergency rooms, I called urgent cares, and I did call my PCP. I actually was hung up on by a couple of emergency rooms.
They basically booted me out of the hospital, like kicked me out of the hospital. The doctors coming in with gas masks and full-on bodysuits, signs on my door saying this room is highly contagious, it's a high-risk room.
The pain was so severe that I could barely sleep. Whether I was standing or sitting, it didn't really make a difference. It was completely interfering with my day-to-day life.
It was akin to what I would probably consider to be like medieval torture because it was so long. It was unending.
The lesions that were on my hands, they really, really hurt. I couldn't wash dishes. I couldn't fold my clothes.
Good news. I finally got my TPOX in the mail from the County of Los Angeles Public Health Department.
So I started on the antiviral medication right away. The nurse practitioner prescribed it to me. She did say, this is purely experimental and I don't know if this is going to work. You are the first patient I've ever had for this.
For only 2 days of being on TPOX, a lot of my symptoms started to improve immediately. The newer lesions that I had actually started to go back into my skin.
As you can see, one of my lesions has fallen off, and I now have a hole in my face.
Applying like scarring topicals and stuff. I'm doing the best that I can to prevent scarring, but I was told that the scarring will fade, but you will forever notice.
Luckily, I'm getting towards the end of my experience with monkeypox. All of my sores have started to scab over.
Wouldn't wish this on anybody. but I'll get through it, and I'll be okay.
So that goes back to also saying, you know what I'm saying, it's hard because it's probably itching and stuff, but you don't want to bust those sores. You need to make sure you wipe things down, like, you know what I'm saying, because the minute you bust those sores, that stuff, and you touch it, you're going to spread it. So we just want to make sure you hand hygiene, sure, and like I said, it's tough. I don't know. Because I don't know what could really, you know what I'm saying? Like, we're in those stages, we don't know what really could work for it. What can, like he said in the video, some of this stuff is experimental because we don't know. And we're not afraid to say we don't know. You know what I'm saying? Health centers are on the front line. We're the first defense. And that's what this week is about, is to recognize health centers like Neighborhood, like Bond Community Health Center, those other type of health centers like Jesse Furlow, who are on the front lines to sit here and say, hey, we're taking this head on. We might not know everything at that point, but like I'm saying, we're working to try to find the stuff that we can do at that point in time, the guidance from the CDC. So it is, and if you do get any type of symptoms like that, stay home.
Please.
Call your people. Don't get on no airplane and fly somewhere to go out of town.
Don't go to work.
Don't go to work. Call your job and say, hey, I'm not feeling well. I just need to get checked out.
Yes.
Trust me, they're going to understand, because the one thing you don't want to do is to have to come down and shut down the whole place. So just make sure that because we're trying to contain it. So guys, just make sure you use hand sanitizer, wipe your hands, wipe off, you know what I'm saying? Just be cleanliness, you know what I'm saying? Be cautious. Wear your face mask. COVID is still real. People think COVID is over with. It's
not.
The last thing you want to do is get COVID and monkeypox at the same time. So, you know what I'm saying? Make sure you wear your mask, do your things. If you wear your mask and it's airborne, you can still prevent yourself from catching things like that.
That's right.
Make sure you sanitize your hands and just listen to your healthcare providers and stay home.
Right. And just remember, these viruses are not man-made. They occur naturally in nature. And I have no knowledge as to how they got out. I guess you can think of this, whenever I say this, I always picture this huge laboratory in heaven, and something escaped. These are not man-made. They naturally occur in nature. And that is why they're so hard to get a grip on. We can only treat. It is so hard right now to eradicate, to get rid of. Smallpox has been eradicated, but as Joe just read, monkeypox is a part of that smallpox family. And so we just have to be careful, we have to be cautious. And also, this is another thing. If you are intimate with someone and you notice a pimple or a lesion that doesn't look right, stop. Just break the mood for a second.
Well, you should have been doing your safe sex precautions from the beginning. But you want to add some things in there now with the presence of monkeypox, because as of right now, we can't test for monkeypox the same way we can test for HIV or STDs, right? So if you meet somebody and y'all know y'all want to take it to that next level, before you take it there, you need to take it to the clinic and get checked out, because at this point there is no excuse for people, especially adults who are having sex, who are not ensuring that they don't have anything, and who are not ensuring that their partner don't have anything. Now,
that's right.
The monkeypox caveat is going to be, well, you guys having more in-depth conversations. Well, how do you feel? Who have you been encountering? Because like they're talking about with monkeypox, because you have to be intimate with somebody.
That's right.
To contract monkeypox. So
that's right.
So if you are encountering somebody who seems to may have some of the signs and symptoms, or they may have some lesions or some bumps on their face that you may not recognize. Now, that doesn't automatically mean that that's monkeypox. But what we are saying is if that person does have monkeypox, that would mean that that person has been intimate with somebody else, which would be more incentive for you to make sure you protect yourself and know their status.
That's right.
And just to let people know, like Joe said, there's not a real test for it to prevent, like before, like COVID, like we can swab your nose and stuff. We actually have to see the lesions. So you have to go to your provider so we can swab that lesion so we can see if it
That's
really
right.
is monkeypox. And that test takes a couple of days to come back. So, but I want y'all to understand, if y'all have any small, if you see 1, 2, don't wait till it gets too bad. Like if you see the 1, 2, call your doctor's office.
That's
They
right.
might, you know what I'm saying, they might meet you somewhere, do something, but we need to make sure we can swab those swabs so we can get a good sample of that so we can see, hey, this really is what it is. And so we can send it out to the lab. But there's no way to test for it previously. So if you come in contact, you can always reach out to the health department and tell the health department, and they can try to get you the vaccine. They're working on protocols now for the vaccine to go out and do those things. So, you know what I'm saying, vaccines are prevention. We're
That's
trying
right.
to tell everybody, you know, saying, hey, there is a limited supply of them. We're not gonna, you know, saying, hey, they're working on it. Just like when COVID hit out, we had a limited supply. Now we have enough supply. So it's just we just got to take our time and work through it. But there are things there, but you need to reach out, have you know what I'm saying, they're going to ask you questions. Make sure you know if you did come in contact with somebody, the dates you came in contact with somebody. What were you doing? Were you around them? Like they're going to ask you all these questions. Who you're around. Don't be afraid to say who you're around. Nobody's going to get in trouble. Nobody's going to do anything, but we just need to know so we can contact trace, so we can find out where it's coming from so we know how to stop it.
And see what Mateus just outlined and what Joe and I have been talking about. See, that is the reason why this week we're celebrating National Health Centers. Because see, we're on the front lines. You know, we're out there doing the hard work, trying to make the communities, the states, the nation safer. We're out there doing the hard work. Yes, you may come across some of the health centers that have a small amount of workers. I mean, we're one of them, but you know what? We get the job done. That's the thing. That's why don't be afraid to go into your national health center. I mean, we don't listen. We eat all the patients before 4 o'clock in the morning. So if you come after 4, don't worry, we're full. Come on, ask your questions. You know, get tested. That is the reason why national health centers are here. Please take advantage of us.
So let's think about it like this. All right. Our health centers are our places where we go to make sure that our bodies and our health is maintained.
Mm-hmm.
So we could be at our best and exist at our best and be able to live our best life, right?
That's right.
That's right.
That's right. That's
we're,
right.
We're a culture now that we love buzzwords and slogans, right?
That's right.
So
right.
How can you live your best life if you're not healthy? How can you ensure you're living your best life if you are not doing your routine maintenance to your body?
That's right.
In addition to that, how can we ensure that we're gonna live our best life if you yourself are not taking care of your health?
That's right. That's exactly right.
When you go to these health centers, one of the things that we're going to tell you is we're going to give you tips and information that you need to do to improve your own health, your personal health.
Mm-hmm.
At the end of the day, my health is my responsibility, just like your health is your responsibility.
That's right. That's right.
But our healthcare centers, our health centers all around the world are there to help us with the maintenance. It's kind of like when you take your car to your dealership to get maintained.
Mm-hmm.
Like it's not the dealership's job to make you do it, but it's the dealership's job. Hey, if you want to take advantage of these services,
That's right.
Now, on the other end of the health center for the healthcare workers, we as being healthcare workers, we want to give a big thank you to all the healthcare workers who are out in the world.
Yeah.
Round of applause for all of
Bravo.
you. Taking our
Bravo.
hats off for all of you.
That's right. That's right.
Especially these last couple years. Look at here.
Mm.
Look at here.
Mm.
These last couple years
Woo!
have been
Hallelujah.
us, right? But we still here and we still kicking, we still moving forward. A lot of challenges, like Ms. Steeple said earlier. We're having within a 2-3 month span, we're having more HIV positive than we've seen in a while. Now I'm trying to look for new HIV/AIDS cases, and we're still compiling 2019 stats from HIV.
Wow.
Right? 2020, 2021 stats still haven't even come out yet.
Wow.
And so they're still being compiled. So think about all of this. All of this information is available. All of these services are available because of the people who put the time and the work in. And so that's why we want to celebrate all those people. Especially people here in our city of Tallahassee,
That's right.
Community Health Center, Care Point, especially here Neighborhood Medical Center, all of our health departments, all of our TMH, CRMC, all of our private doctors.
Right.
What's the walk-in?
The urgent cares.
Yeah, all of our urgent care centers, all of our dentists, all of our chiropractors, everybody in any realm of health. Thank you, because we're like Voltron. We're all like Voltron, and we got to connect together to make this thing happen. Right. If we don't, we're gonna have an issue.
That's right.
We got to support each other. Look, collaboration over competition will always get the job done.
That's right. That's right. And I mean, it is you may work for place A and I may work for place B, but the fact is that the ultimate goal is for a safe community. That's the bottom line. There's still communities that are out there. They're hot spots for COVID still in this day and time still. And so once again, it's just like a church, sinners make up the body of a church, right? Because nobody sits in church as the perfect being. Well, it's the same thing. The communities are made up of different kinds of people, but we don't want to live in a community where we're at each other's throats, because guess what? We're not going to survive. That community is not going to survive long. But if you work together, if you decide that you know what, I am my brother's keeper, I need to make sure that if I'm sick, I stay home from work. That if I'm intimate with somebody and I notice a lesion, then I need to put that physical relationship on the back burner until I find out what's going on. Let's just, it's just thinking about each other.
And Ms. Steeple, to piggyback off of that is also to let people know that it's just not one type of population like LGBTQ that can contract monkeypox. That's been put out there. Yes, a few cases have been found in that, maybe first starting out, so it does look like it's affecting, but it affects everyone. It affects everyone from Black, white, Asian, Hispanic, young, old, middle-aged. I mean, anybody, male, female, transgender. So I just don't want people to think, oh, it can't affect me because I'm not of the LGBTQIA population. It can affect anybody. And it can affect kids to anybody. So just make sure that you really, be careful. Parents, make sure your kids, you watch them and don't let their hands go in their mouth because they at that touch age thing. Don't put them on the floor at your doctor's offices and let them roll around. Don't do those type of things because those are quick ways to pick up stuff. So not just monkeypox or COVID, but it's other things. So just make sure you try to, be a little bit more cautious of when your kids are there, especially like if they go to the grocery store and they put their mouth on the grocery. Like I've seen kids do that. So like just make sure to be careful, but it's not going to affect just one population because that stigmatizes people. And that's what we're trying to break with HIV. We're trying to break that with anything is we don't never want to stigmatize a disease because then we'll be able to miss that because people won't come in to get the care they need and the help because they feel like they're going to be judged or saying, blamed upon for, oh, I gave these people monkeypox or something else. So just make sure y'all just don't stigmatize it. Y'all, let's just try to get to the bottom of it, and it can affect anybody. So
And,
don't be just
and
looking at one piece.
that's exactly right, Mateus. And please, we're here to answer your questions. If we don't know the answer, I guarantee you we're going to talk or speak with someone who has the answer. We're that is why we are called what? National Healthcare Centers.
Because we everywhere. These places are everywhere. I was a gentleman called me earlier.
I love that.
Gentleman called me earlier, and he was explaining the healthcare organization that he was a part of, basically similar to us. And it was funny because he was trying to sell me on the idea of like the communal care FQHC place. And he was kind of long-winded, but he was trying to sell me on it. And I'm like, halfway through it, I figured out what he was talking about, but you had to get it out. So when he got through, I'm like, hey, yeah, I do this every day. Like, this is what I wake up and choose to do every day. You know, well, it's not something that I have to do.
Nope.
It's not something that somebody's forcing me to do. I literally get up and choose to come to the neighborhood every day because I like doing what I do. I enjoy doing what I do. I enjoy being able to help people. So with that being said, we do a couple announcements. So Friday, August 12th, and you might be seeing this on Friday. So Friday, August 12th, from 12 p.m. to 4 p.m., we're doing free HIV testing at the Time Saver at the corner of Brevard and Old Bainbridge. So spread the word if you need a free HIV test. Friday from 12 to 4 at the corner of Old Bainbridge and Brevard and Old Bainbridge. That's coming up. What else? What? Oh, food drive. We're doing another food drive on the 25th.
Oh, great.
That will be a Thursday. So the last Thursday of the month, the 25th, from 10:30 to 1 p.m. here at 438 West Brevard Street. We're doing another free food drive. Last couple food drives have been excellent. If you see this clip, you are a healthcare provider, or you provide resources in Tallahassee area, and you want to be a vendor, you want to come out, pass out your information, jward@neighborhoodmedicalcenter.org is the email. jward@neighborhoodmedicalcenter.org. Or send a message on Instagram, Neighborhood Heroes on Instagram, or Neighborhood Medical Center. But we will be promoting that on Instagram and on Facebook as well. But I do want to say it here, so it'll be on YouTube, and we take this clip and use it too. But Thursday, August 25th, 10:30 p.m. to 1 p.m., we're doing a food drive in connection with Second Harvest and the City of Tallahassee. So thank you to Second Harvest. Thank you to City of Tallahassee. So we got those things coming up.
Also, Joe, we got the Tallahassee AIDS Walk coming up. Anybody wants to be a participant, it's free to participate to walk. If you want to be a sponsor, we have different sponsorship levels, but all the proceeds go back to the HIV community here in town, split between 3 different agencies: Neighborhood Medical Center, Bond Community Health Center, and CarePoint, or Big Ben Cares, which are the 3 Ryan White providers here in town. So we're raising money to help, go back into the into our community to help things, because we all know everything. We try to do everything. Like some places pay for housing, some pay for food, some pay for healthcare, and we're doing those things, but those cost money. And so everything's going up, like we know the economy is. So we're out here trying to raise money to help bring awareness and everything else, as well as the reasons why we walk for HIV, so we can keep fighting for this, so we can get to the end. So we really want people to understand, hey, come out, support. That's the biggest thing. You can go on through any of our websites, through Neighborhood, Bond, Big Ben Cares. It's on Facebook. It's on Instagram. Find that register link. We sharing, we posting, we doing all this. We just want to make it to be a big thing. We a small city, but we feel like we big at heart with Joe and me. We really feel like we big time people in the city. So we really want people to come out and make this a big event. Let us know. What you say, Joe?
We big time. We big time.
And
But
so
you,
we just want people to understand, like, you know what I'm saying? We come in here to put on events. You're going to get education. You're going to get all this. But come out and see what local services you have, because you'll find something. If you're not in care, you got 4 or 5 agencies that have tables out there that you can sign up right then and there. You can still come out there and get HIV testing if you want to get know your status. So it's no reason for nobody not to be out there to get that information. So
That's
just
right.
come out, help support. Even if you don't know about it, it's a way for you to find out about it and let us know. So
so
just
right.
come out and support.
So make it real easy. Link to register for the AIDS walk is in the description. So make sure you go to the description, just click the link, and it's easy to sign up. So 2022 Tallahassee AIDS walk. Um, we're expecting over 300 people.
And it's free, right, Joe? It's
Right, so
free.
free event.
Now, if you want a shirt, you got to pay for the shirt. That's the only thing we're asking people to pay for. Is if they want a T-shirt that say Tallahassee AIDS Walk, then they'll have to pay for that shirt, and that comes with registration. But if you choose no shirt, it's totally free. You can sign up, you can walk. You don't have to wear no shirt, no nothing like that. You just have to come out in some
That's
workout
right.
clothes and be ready to walk and enjoy.
And if you're not walking, I'm speaking for that community as well. Bring your wheelchair or your mobility device. Vroom vroom. Bring it, and I promise you, you'll be definitely welcomed and appreciated. So come on.
And it's a family affair, so bring your kids.
Right.
It's a great place to.
Right.
Hey, it's after 6. It's around 6 o'clock. Let's tire them out so they can go home, get in the bed, get a bath, and put them to sleep. They get a little walk around the little lake park
That's
for it.
right.
So,
That's
but I
right.
mean, it shows the community that hey, we're all coming together to take part and try to jump into this fight, because we all in this fight together, and not
That's
one
right.
person can do it by themselves. So that's why we're coming together as a team.
Right. So last announcement is Neighborhood Medical Center is a sponsor in conjunction with the Tallahassee Beer Fest. So you can go to www.tuckerciviccenter.org. That link is in the description as well. Use the code NMC to purchase your tickets, because we're in the campaign to help raise funds for neighborhood, but also help for our community and help Tallahassee Beer Fest. And it's one of the events that we are in conjunction with. So it's going to be the 4th annual Tallahassee Beer Fest, September 10th to the 6th. We will be there. Make sure you use the code NMC to get your tickets. If you really want to have a real good time, you need to get them NMC tickets. There ain't no tickets like them NMC tickets, because them NMC tickets don't
That's
stop.
right.
Okay?
That's right.
Hey, we don't stop.
There you go.
That's right. That's right.
There you go.
Okay.
So, hey man, this is how we do it. I'm Joseph Ward. She's Elena Steeple. He's Matthias Sweet. Shout out to Miss Kara Brown. Shout out to Miss Janae Freeman, our CEO. Shout out to everybody at neighborhood. Shout out to you all.
Dr. Foster, Sharon Foster, our CMO.
Our IT people who make everything happen.
That's right.
Ian and Mark, we thank y'all.
That's
thank you to
right.
all the
Thank
managers,
you.
everybody
Thank
who
you.
sits here, Nancy and Yolanda who help out.
Oh
Dinah
my
from the front
God.
desk. It
Look.
takes everybody to make
Yes,
this.
everybody.
The front desk screeners.
Yeah.
Shout out to you all. Shout out to the people who come and help clean up the building, who sweep. And
Oh my gosh. Yes.
We appreciate you all. We appreciate everybody at every level. Ain't nobody better than anybody else.
No,
this is a team.
never.
This is
never.
a team. And
This
don't do
team.
your job. Because I tell it like this.
That's right.
You know how you forget how important your pinky toe is.
That's right.
Until you hurt it.
That's right.
You hurt your pinky toe and it throws off all your balance. And next thing you know, 2 days, if you hurt your right pinky toe, your left leg hurting for trying to compensate for your pinky toe.
That's right. That's right.
So,
That's right.
With that being said, everybody is important. That's why we're doing this podcast, to make sure we let everybody know.
I want to say one thing, Joe and Matthias, is that I know personally that it's not just a team, but neighborhood is also a family. This summer, unfortunately, I lost my mother, and that was it's very painful experience for me. And I can honestly say that it's my work family that really has just been there for me to help me through this, in addition to my biological family. So we just don't see each other as just co-workers. We're family members that are there for each other. We just so happen to work together. And that is how I wish for others to see their community that they live in. Don't just look at them as the person two doors down. Look at them as a part of your community family. And I guarantee you, if you look at people like that, I guarantee you, you will start changing your perception as to how you want to care for them. So I just wanted to give that shout out to my neighborhood family. You know, I love you all, and
Love you too, Miss April. But see, that goes right into what the theme for National Health Center Week is, because we didn't say what the theme was, because we do a theme every year. But the theme is community health centers, the chemistry for strong communities. Because behind every strong community is a strong health center, or every health center, there's a strong community.
That's
so,
right.
like, hey, we here. We're trying to make our community strong, just like we are. And
That's
the more
right.
we do together, the more we'll be able to take anything head on like we're doing now.
Yep. You heard it. You heard it. We ain't got to say it
Right
again.
here.
I know you heard it. All right.
That's
So
right.
remember who we are, what we do. Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may or may not have access to. We seek to empower, inform, uplift, and mobilize our listeners to become the healthiest versions of themselves. www.nmcpodcast.com, as well as www.neighborhoodmedicalcenter.org. Remember, we're on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. But this YouTube channel, make sure you like this video, make sure you subscribe, make sure you share and comment. That help the algorithm, that help more people see this information that we're giving to you all. Once again, the tea is sweet. Miss Elena Steele, I'm Joseph Ward, and we'll see y'all in the streets.
Yes.
All right.
Bye-bye.